Angiotensin-converting enzyme, ACE, inhibitors are widely prescribed medications for managing high blood pressure, hypertension. They are also commonly used after a heart attack to treat heart failure and to slow kidney damage caused by diabetes. Some well-known ACE inhibitors include lisinopril, Zestril, enalapril, Vasitec, and benazepril, Lotensin. While ACE inhibitors are effective and life-saving for many patients, they are not without potential risks. Understanding ACE inhibitor side effects is essential for making informed decisions about your treatment. Below, we outline 7 of the most important side effects, starting with one of the most common, ACE inhibitor-induced cough. 1. ACE inhibitor cough. An ACE inhibitor cough is one of the most recognizable and frequently reported side effects. This type of cough is typically dry, persistent, and accompanied by a tickling or scratching sensation in the throat. While it is usually harmless, it can be disruptive and uncomfortable. Research suggests that ACE inhibitors increase levels of proteins, such as bradykinin and substance P. These proteins may cause the airways to constrict, leading to coughing. This side effect can appear shortly after starting the medication or develop months later. If you suspect that your cough is caused by an ACE inhibitor, consult your healthcare provider. In many cases, the cough improves over time, and the benefits of continuing the medication may outweigh the inconvenience. However, if the cough is severe or interferes with your quality of life, your provider may recommend discontinuing the ACE inhibitor. The cough typically resolves within a few weeks of stopping the medication. When discontinuation is necessary, healthcare providers often switch patients to an angiotensin II receptor blocker, ARB. ARBs, such as losartan, Cozar, valsartan, Diovan, and olmesartan Benicar, provide similar benefits without the risk of causing a persistent cough. 2. Low blood pressure, hypotension. ACE inhibitors are designed to lower blood pressure, which is their primary therapeutic goal. However, in some cases, they can lower blood pressure too much, leading to hypotension. This risk is higher if you have certain medical conditions, such as aortic valve stenosis, or if you're taking other blood pressure-lowering medications, such as diuretics, water pills. Symptoms of hypotension include dizziness, fatigue, lightheadedness, and general weakness. It is recommended to monitor your blood pressure regularly at home if you're taking an ACE inhibitor. For many individuals with hypertension, a common blood pressure target is 130/80 mmHg, but your healthcare provider may suggest a personalized goal based on your health needs. If you notice consistently low blood pressure readings or experience symptoms of hypotension, consult your healthcare provider. They may adjust the dosage of your ACE inhibitor or modify other medications in your treatment plan. Severe hypotension requires immediate medical attention. Warning signs include cold and clammy skin, rapid breathing, or a weak pulse. If you experience these severe symptoms, call 911 or seek emergency care right away. 3. Dizziness. Dizziness is another common side effect of ACE inhibitors. Because these medications lower blood pressure, your body may need time to adapt, especially during the first few days of treatment. This adjustment period can result in temporary lightheadedness or dizziness. Most cases of dizziness are mild and improve as your body becomes accustomed to the medication. However, if dizziness persists or becomes severe, your healthcare provider may recommend lowering your ACE inhibitor dose or switching to a different type of blood pressure medication. Severe dizziness that interferes with normal functioning, especially if it involves fainting, trouble speaking, or confusion, can be a medical emergency. In such cases, seek immediate medical attention or call 911. 4. Kidney problems. ACE inhibitors are generally protective for kidney health, especially in individuals with high blood pressure or chronic kidney disease. These medications improve blood flow to the kidneys and are often considered a first-line treatment for patients with these conditions. However, in rare cases, ACE inhibitors can cause kidney problems or worsen existing kidney damage. This risk is higher in individuals with heart failure, pre-existing kidney disease, or those taking other medications that affect kidney function, such as diuretics or nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, Motrin. Most changes to kidney function caused by ACE inhibitors are mild and reversible. Healthcare providers routinely monitor kidney function with blood tests before and during ACE inhibitor therapy to detect any issues early. If significant changes are found, your provider may adjust your dose or stop the medication. Be alert for symptoms of kidney damage, including reduced urination, swelling in the legs or ankles, or shortness of breath. If you experience these symptoms, contact your healthcare provider immediately. For severe symptoms, seek emergency medical care or call 911. 5. High potassium levels, hyperkalemia. ACE inhibitors can sometimes lead to high potassium levels in the blood, a condition known as hyperkalemia. While this side effect is usually mild, severe hyperkalemia can cause dangerous heart rhythm disturbances, which may be life-threatening. The risk of developing hyperkalemia is higher if you have diabetes, kidney disease, or if you're taking other medications that raise potassium levels, such as beta blockers or potassium supplements. Before starting ACE inhibitor treatment, it is important to tell your healthcare provider and pharmacist about all prescription, over-the-counter, OTC, and herbal medications you're taking. This helps reduce the risk of harmful drug interactions. Hyperkalemia often has no noticeable symptoms. However, when symptoms occur, they may include muscle weakness, tingling sensations, or nausea and vomiting. If you notice any of these signs, contact your healthcare provider immediately. They will assess your potassium levels and determine whether adjustments to your ACE inhibitor dosage or treatment plan are needed. 6. Angioedema. Angioedema is a rare but serious side effect of ACE inhibitors, characterized by sudden swelling of deep tissues, most commonly in the face, lips, tongue, neck, or throat. Although it affects fewer than 1% of people taking ACE inhibitors, it can occur at any time during treatment, even if you have been taking the medication for months or years. This reaction is thought to result from a buildup of bradykinin, a compound that can increase tissue swelling. In severe cases, angioedema can block the airways and cause difficulty breathing, which is a medical emergency. Certain groups are at higher risk for angioedema, including women, African American adults, and individuals over the age of 65. If you notice swelling while taking an ACE inhibitor, contact your healthcare provider immediately. If the swelling worsens rapidly or you have trouble breathing, seek emergency care or call 911. Important note: if you have ever experienced angioedema while taking an ACE inhibitor, or if you have hereditary angioedema, you should avoid ACE inhibitors altogether. 7. Birth defects if used during pregnancy. ACE inhibitors carry a boxed warning, the FDA's strongest warning, against use during pregnancy. These medications can cause serious harm to a developing fetus, including impaired kidney development, reduced amniotic fluid, birth defects, or even miscarriage. If you're pregnant, planning to become pregnant, or think you might be pregnant, you should not take ACE inhibitors. If pregnancy occurs while you're on an ACE inhibitor, contact your healthcare provider right away. Your provider will likely recommend stopping the medication and switching to a safer alternative. However, never discontinue ACE inhibitors on your own without medical guidance. Abruptly stopping blood pressure medication can lead to uncontrolled hypertension, which is dangerous for both you and your baby. ACE inhibitors are powerful and effective medications for managing high blood pressure, heart failure, and certain kidney conditions. However, being aware of ACE inhibitor side effects, from cough and dizziness to more serious risks like angioedema and birth defects, is essential for safe use. Always monitor for new or concerning symptoms and consult your healthcare provider before making any changes to your treatment plan. ACE inhibitors are highly effective for treating hypertension, heart failure, and certain kidney-related conditions. However, they can cause side effects, including ACE inhibitor-induced cough, low blood pressure, high potassium levels, kidney issues, and angioedema. Although most side effects are mild, Some can be serious and require immediate attention. Before starting ACE inhibitor therapy, discuss the potential risks and benefits with your healthcare provider. If you experience any severe symptoms, such as trouble breathing, severe swelling, or vomiting, do not hesitate to seek emergency care. Want more expert health advice? Subscribe to HeInfo for reliable, doctor-reviewed health tips and in-depth videos about medications, wellness, and healthy living. Like, share, and comment if you found this video helpful, and don't forget to hit the notification bell to stay updated with our latest content.